Good afternoon, ladies and gentlemen. So I'm looking forward to taking you through some discussions around women's health and in particular the growing burden of non-communicable diseases. So we know from a WHO report that 70% of deaths globally, both in males and females, arise from preventable and reversible conditions. We also know that these NCDs account for almost 65% of female deaths globally, meaning that over half of the women losing their lives over the year globally are from diseases that are in fact preventable and in some cases reversible. I know that my colleagues on the panel here do a lot of work when it comes to women's health. To start off with, I'm interested in understanding what are some of the challenges that you face with not only women's health on an individual level, but zooming out a little bit and looking at it from a community-based level. So Dr. Nadia, we'll start with you.
Bismillah ar-Rahman ar-Rahim. Good morning, everyone, and thank you, Forbes, for this great invitation. Actually, when we have to talk about, the community involvement, especially in the fluctuation of the social levels in the Arab countries, our challenges are quite different. Because in some countries, as a Clean Group and the Muassas Tash'aib, we work in most of the Arab countries. Our challenges, sometimes are very, very different. In some countries, it's more scientific-based challenges and cultural-based. Some others, they are more financial-based challenges. We really need the engagement of the CSR very actively and very proactively in the Arab world. This is a first challenge. Second, as earlier Dr. Amin Al-Amiri cited and Dr. Marwan Abdelaziz, also as a scientific background, originally Clean Group is a pioneer in the clinical research and clinical trials in the region. So again, what we aim for with all the stakeholders is really, to consolidate maximum the research so that we have better profiles of the women health in general, health in general and women health in particular. And when it comes to the biggest, NCD concern in our region and worldwide, which is the cancer. And this is where more specifically we are taking, I'm sorry, I'm answering both between 1 and 2 because between the challenges and the solutions. So I want to say wherever there is, a problem, there's always many alternative solutions to sort it together. So to stress with the challenges, it's mainly, the social and financial fluctuation between the Arab countries. This is where the CSR comes. And the second, more and more synergy on the science and on the awareness. Those two challenges shall be the main, awareness together on how to consolidate them and to find out solutions together. This is about your first question.
Thank you. You briefly touched on some of the challenges being socially related. We know that middle to low class income countries, women are disproportionately affected by these non-communicable diseases. Challenges that I have personally seen range from socioeconomic, access to healthcare, cultural. So Dr. Asma, I'm interested in understanding from you some of the challenges that you have seen, and off the back of that, some successful initiatives that you yourself have led on.
Thank you so much for having me today, and you've highlighted some of these important challenges, access specifically, and emphasis on to what Shaista said earlier and what you just said. All women, regardless of their socioeconomic status or what stage of life they are in, they must be able to access preventive health programs and all the unique services that branch out of them. So what we try to do, or what we do at the ambulatory health services, is that we make sure that some of the specialized services are available to women within the centers at the heart of their community. And we also use our mobile solutions, teleconsultation, and the Pura to reach out to women who can't reach out to us. Another challenge which I would like to highlight again is awareness. not so many women are actually aware of the importance of preventive healthcare programs, genetic screening, early detection. And it's not only the physical health, it's also the mental health. That's very important and contributes to the environmental factors that contribute to the non-communicable diseases. And what we do at AHS is we leverage on our partnership with Sakina, which is a comprehensive mental health program, and we create strong educational programs and we try to spread awareness. The last challenge, which is equally important challenge, is integration. So sometimes healthcare systems fail to approach women's health in a holistic approach, so there is always a focus on the physical component. Well, the mental component is equally important, and what we did, again in partnership with Sakina, is we have upskilled our family physicians to be able to approach women in a holistic way and be able to identify physical and mental components that pose as a risk on their health.
Thank you. Yes, I like the reaching out to women that can't reach out to us, because I think across the world, awareness for women's health in general needs a lot of work done for it. You touched on the physical aspects and the mental aspects. So we know that lifestyle factors such as physical inactivity, poor nutrition, lack of integration as communities, they all contribute to these non-communicable diseases. Dr. Jalen, I read a piece of research the other day, and this is leading on to the question that I will pose to you, that only 23% of women globally are reaching their physical activity goal for the day. Based on that, can you talk us through the importance of physical activity and nutrition, not only in the management of these NCDs, but also in the prevention as well?
Thank you for having me today. I'm honored to be today in Forbes. Many studies concerned with the physical exercise, as it has very big impact on the woman's health. Physical exercise can manage the immunity, increase the immunity, and decrease the inflammatory reaction. And the inflammation is the main cause for cancer. Also, it decreases the risk of occurrence of breast cancer, as I concerned, of course, with breast cancer. Making excessive physical exercise control the obesity, which is a very high risk for cardiovascular diseases and diabetes, breast cancer also. Physical exercise control the level of hormones such as estrogen in women, and it's a main cause for breast cancer. So physical exercise can prevent many diseases, cardiovascular, diabetes, hypertension, cancers, different types of cancers. It also has a big role in treatment. You cannot give any woman or any person a full dose of treatment unless he is in optimum weight. Otherwise, you may lead to toxicity or under-treatment dose. So you have to be in a good weight to continue your treatment. Obesity makes depression, and depression is a very control point in treatment of breast cancer and other type of cancers. So you have to have physical exercise to prevent disease and treat it. The latest study proved that exercise for 1 hour can prevent the reoccurrence and recurrence of breast cancer. And this is the latest study. 1 hour physical exercise per day prevent recurrence of breast cancer disease. Also, nutrition have very big impact on health. High sodium food can cause hypertension. Saturated fat and trans fats can cause cardiovascular disease. Hormone-rich food can cause different type of women cancers. So different type of nutrition can cause different type of diseases. So we have to have balanced nutrition. to prevent disease and also continue without suffering from chronic disease?
I think we can all agree here that if we look at one of the biggest risk factors for NCDs, I think we can agree that obesity is one of them, right? We know that it increases the risk of cancer, cardiovascular, diabetes. At Longevity UK and now Zoe ME, we are very much data-driven. We love evidence-based practices. Following on from that, can I ask you, Dr. Nadia, to share some specific programs or evidence that you have seen where physical activity and nutrition can have a positive impact on mitigating the risks of non-communicable diseases?
Yeah, actually, I can't but acknowledge what Dr. Asma and Dr. Jihan were saying, because from one side, indeed, awareness. So when we speak about the synergy, it has to start by awareness. As says Platon, if we don't recognize our ignorance, we cannot learn. So indeed, it's always a matter of starting by, increasing the awareness and synergizing, because we have so many common factors in our countries. I mean, for example, Egypt, Jordan, I'm talking about Lebanon and many countries that Clean Group represents. So, and indeed with Bahia Center, for example, which is leading in the women cancer, and what is Dr. Jihan is saying, for example, 2 days ago, a Women Cancer Institute has been created in the French hospital of Beirut. So this is where synergy can come always the way. And this is why always basing on, CSR, awareness, to fight those, I want to say, to remediate to those challenges that we were saying. This is how we are currently, we took an initiative where we are consolidating under a database, under a platform that is called IWA, because this is Arab Yes Women Together for Health, part for empowering women from empowering her health, whether her physical or her mental health. And we aim for, through IWA, indeed to, synergize between the Arab great expertise in women health, whether it comes mainly from women, because most of the time it's a legacy between us, or when it comes from also all women health experts, because as we know, most of the gynecologists, for example, are still men, so which is good, and which means that also they are empowering the woman health because they are the expert in the women health sciences. So this is where we aim for synergizing through AUA, and it started with several success stories, and this is how I was so happy to physically meet Dr. Jihan today. But however, we already have many connections through this synergy for AUA that we aim for creating through synergizing through all over the women health program, particularly starting by the women cancer in our case, because we have a lot to share. We have almost we have many common genes together. We spoke earlier about the genetic challenges. So we have so many cultural, factors together. So it's very, very easy in our Arab region, really, if we put all the efforts together to synergize over the women health initiatives, as I'm talking about IWA, and starting by the women cancer, because as we know, it's always, whenever a woman has a cancer, it's the whole family that has a cancer.
Yeah. I think it's interesting that you mentioned there that predominantly gynecologists are still male. I'd just like to highlight the fact also that many of the drugs that we use to treat these NCDs have in fact mostly only been tested in clinical trials on males as well. So, as women, we are being given drugs that actually we don't have much data that represents us for those. So, Dr. Asma, I'm interested to hear
I just
from
want
you.
to add, especially about what you're saying now. For example, because I'm a specialist mainly of cancer research, original expertise after the growth of Clean Group in many other sectors, but the main. So I can tell you that the treatment responsiveness in the cancer in general is very genetic related. So when it comes, sometimes the clinical trials are made in the EU or the US or whatever, and it comes that as an indication for a high treatment responsiveness. Sometimes it fails in our countries, not because the doctor did not prescribe the right, but because the genetic related to treatment responsiveness is very high. This is one reason more to emphasize on what you just said earlier about the importance of this synergy and gathering all the way.
Yeah. Dr. Asma, I'm interested to hear from the work that you do. Are there any specific programs that you do that you have seen that have an impact on non-communicable diseases in women in particular?
Yes. Yes. Before I talk about the program, I want to take a moment to highlight the importance of collaboration. For any such program to be successful, there should be, as Dr. Nadia said, synergy and collaboration between the partners. And if you club that with significant large-scale awareness campaigns, you will be able to reach a point where you can guarantee the success of the program, which we did. And we have seen over time an increase in the number of women who perform the screening or early detection. Now, the program is a longevity program of Pure Health, and the longevity program of Pure Health is a powerful tool. It's obviously scientifically evidence-based program, but why it's unique, because when you club it with Pura, it provides a lifetime partner to women, okay? The program focuses on ensuring that women build a strong immune system. It focuses on providing them with an active lifestyle and thus reducing the risks of being exposed to cardiovascular disease or diabetes. How do we do that? When we talk about active lifestyle, we talk about empowering women to exercise. Our partnership with Active Abu Dhabi is important because Active Abu Dhabi gives women a tailor-made solutions that suits everybody. It's available for all women. And we have a team of leading dietitians under the umbrella of the ambulatory health services who can work with women and do work with women to ensure that they have a balanced nutrient-full diets. And when you have both together, you actually empower women to have a more comprehensive approach to the risks that they have and to how to sort of minimize these risks. And by doing so, we give women a longer health span, and we actually give them more time, good time where they can build memories. So that's what we do at Pure Health and AHS.
Yeah, amazing. I think in preventative health in general, you can't do preventative health without it being super personalized and getting the right intervention to the right person at the right time. So thank you for joining me today, and thank you for your input on the discussions, and I hope you continue to do all of the work that you do at the community level for women's health.